Hello, my name is Solomay Tibabu. Welcome to the Going Digital Behavioral Health Tech Summit. I'm so thrilled to have Dylan Landers Nelson with us. Thanks so much for joining us, Dylan. How about you tell our audience a little bit about yourself and Business Group on Health?
Great. Thank you so much for having me. I'm really passionate about this topic of mental health, and I'm really appreciate the chance to give our perspective and a little personal experience on the issue as well. Business Group on Health is a nonprofit member association based in Washington, D.C., though these days with the pandemic, we're kind of spread out all over the place. We have about 430 members, the vast majority of which are large self-insured employers. And our constituency at those employers are the HR benefits strategists and leaders who are making decisions about contracting, plan design, how they work with vendors to deliver high quality benefits to their employees and covered dependents. We also have a small policy focus, though, as a nonprofit. It's a lot of our work is focused on educating our members on what's going on in DC. And then we do a number of benchmarking surveys, keeping our members up to date on what their peers are doing. We also have a subset of our membership that are industry partners, so companies that are in the business of working with employers to deliver high quality benefits. My role at the business group really focuses on three different things. One is value-based purchasing. I lead our executive committee on value purchasing, really focused on the area of the intersection between employers and the healthcare delivery system and payment reforms. I also lead our Health Innovations Forum, which is a subset of our membership that we consider to be some of the most leading employers who come together multiple times a year to strategize on identifying effective innovations, promising innovations in the market and scaling them, whether that is a new vendor or just a benefits strategy in general. And then I also coordinate much of the business group's mental health work. We have a number of teams, and we've made the explicit decision to make sure that mental health is included in all of the work we do, rather than kind of having it in a silo as a specific work group, because we think that the brain is part of the body, and any of the work that we do is going to in healthcare is going to have an impact on the brain, and the brain is going to certainly have an impact on the care that people receive and the way that they seek it. So it's helpful to have a team that I have the pleasure of working with to make sure that we're aligned on what we do. I would say personally, I've been at the business group for 7 years now. I have a particular passion in mental health and also delivery system reform. And by training, I've public health degree and really think that employers have a strong role in improving the health of over 100 million employees, people in the US and around the globe. So that's me.
Wow, with such an expansive role and perspective that you have, one basic question I would love to hear more about, given this last year, is what are employers doing as a result of the pandemic, specifically as it relates to solutions to support their employees?
Yeah, so a huge amount of work. I mean, this is, many of our members, we've got about 75 of the Fortune 100 and a couple hundred of the Fortune 500. So we're talking about massive household brands. These are companies that are operating in many cases all around the globe. And so it wasn't just in March of 2020 when the US started going into lockdowns that many of our employers were thinking about what they were going to do in response to the pandemic. It was earlier than that. And our members really pushed us and to help them strategize on what they were going to do. So there were a number of things early on where we worked with our members to try to just figure out, okay, there's a lot of uncertainty about what COVID-19 is and how it's spread. And, while HR is traditionally not in the business of figuring out how workplaces are designed or working with other teams necessarily, they and most of our members kind of created these task forces where people across corporate leadership were working together to try to get a handle on what they were going to do. And in some of our survey work, we've been tracking kind of how our members see their benefit strategy and whether it's kind of an integral part of their workforce strategy. And that shot way up last year because the way that people were accessing their benefits, accessing the healthcare delivery system had a huge impact on their ability to work and be safe and be, productive, healthy, happy employees and human beings. In terms of some of the nuts and bolts and of what our employer members did in response to the pandemic, the biggest response was putting in virtual care options, whether putting in new vendors that were able to deliver on healthcare services virtually in a way that employers had not interfaced in previously. The vast majority, like 98% of our members covered telehealth prior to the pandemic, but certainly the options that they made available to their members increased. About 75% of our members either put in new programs or reduced financial barriers or increased communications related to virtual health options for their members as people kind of started to reduce the amount of healthcare that they were getting in bricks and mortar settings like they had traditionally. Certainly related to the work we're doing, in this conference and brought this together specifically is we saw 43% of our members reported putting in new mental health services or, partners to, deliver on what is, I think a huge need for people in the US and the world over is, support for mental health, whether that's kind of low level anxiety created by, a global pandemic to, some of the increasingly, tragic events where people who already had mental health challenges are separated from, the basic supports that they had, whether that's, interaction with loved ones, standard kind of, just kind of the general patterns of their life that provide some stability. I mean, we all know, I'm sure you'll hear this a number of times throughout the conference, that just taking people out of normal life and the supports that they have generally has been a huge challenge. So, I would say virtual health and mental health are the two most pertinent to this group or into this conference, but we saw a number, creating more flexibility in terms of scheduling. Obviously, for workers who could work from home, that was a huge change that was done very quickly. Certainly, talking in the U.S. in March, people went home, and for many of us, millions of us, we've been home ever since. And so, supporting people on how they set up a home office, how they have social interaction, certainly, caregiving. I think we've seen employers more than ever be kind of understanding and put in place policies to support people who were suddenly, being, educators and taking care of kids in the home while also trying to get their work done. So, a lot more flexibility in place. And then certainly for those employers who have employees that are, essential workers and are really doing, God's work and making sure that the world can kind of continue. There were a lot of, structural, supports put in place to make sure that people could be as safe as they possibly could. Again, more flexibility put in place, understanding that, someone working in a grocery store also often have kids who weren't able to go to daycare or school. And then again, just with new programs going in place to help take care of people.
Well, you've certainly seen a lot of employers implement all of the many solutions that you just mentioned. Can you offer our audience any key considerations for how an employer trying to create a comprehensive benefit can get started, or anything they should really keep in mind?
Yeah, absolutely. So, if we're talking specifically mental health, I think, there are a few things that you really want to keep in mind. One is just making sure that what you're covering kind of runs the gamut of, I guess, the severity of, challenges that one might have related to mental health. So, there are a number of companies that are providing supports to what we might consider to be kind of subclinical, conditions, or people who don't have a diagnosis but could benefit from resiliency training or better sleep, or that sort of thing. You want to make sure that you've got, all the way to, people who are in crisis and everything in between. You want to make sure that you're covering kind of in the same way that you would cover, physical therapy and orthopedic surgery, in any other kind of, clinical area for what we might call physical health. You just want to make sure that you're covering that spectrum. I think another thing that's important to remember is that mental health is not just anxiety and depression. And so you want to make sure that if you're creating a comprehensive mental health benefit, that you're considering other kind of conditions or things that people are dealing with in their daily lives related to mental health that are not just those two. Another thing that you want to make sure that you're doing is providing different avenues for people to access mental health care. For some people, they're really going to best be served through, bricks and mortar face-to-face visit, though that's increasingly difficult to do these days. Others are going to be better served, virtually, face-to-face, sort of like you and I are doing right now over, computer screen. Others are going to benefit from chat bots and asynchronous communication with providers. So just giving people as many opportunities or as many ways to access care as possible. Certainly we have a diverse, society of all, ages and regions, and you just want to make sure that you're giving people as many ways to access care as possible. And then I would say, speaking of diversity, now more than ever, and I think one of the silver linings to a very difficult, year and a half these days is just I think we're seeing a lot more frank conversations about race and culture, and what that means for people's health and health outcomes. And I think I personally, and recognizing that I'm coming at this from, a privileged position as a white, straight male, is, I think a silver lining is just, at least regarding mental health and race, that conversations are being had. They're being had publicly, and you can't really, exist in a pandemic, in a news environment right now, and pretend like these aren't, big challenges that we need to address. Whereas I think previously there was either a lot of stigma or people kind of dancing around the issue, or in some cases just, the ostrich sticking its head in the ground, not wanting to address them. So you want to just make sure that, if you're an employer and you're putting in, programs or strategies or communications related to mental health, that you are communicating in a way that's, culturally competent, recognizing that, if you've got thousands or tens of thousands or hundreds of thousands of employees, that you're going to have a lot of diversity, and some messages are going to work better for others depending on their circumstances.
That's so great. I could appreciate all of that. And I hope many of the things that you've outlined just continue to grow, and I hope that we continue having these really important conversations Now, how about on the innovators side? Do you have any advice for some of the startups in the audience or other behavioral health tech companies and how they can succeed with employer partners?
Yeah, absolutely. So, as I mentioned in my introduction, one of the kind of, I'll say, cool projects that I get to work with or work on at the business group is our Health Innovations Forum. So, as I said, 35 of, what we would consider to be some of the most progressive leading employers, vetting startup companies. And I think, as I consider who has been effective, one is learning the language for speaking to self-insured employers. Um, we have a number of folks who come from healthcare, or they come from Silicon Valley, and they don't necessarily speak the language of a self-insured employer, or have some knowledge of kind of the procurement and kind of vetting processes of a self-insured employer. So, spending some time doing some research, or getting some advising on some of the unique challenges of and opportunities. I don't want it to sound all negative, certainly, of pitching to an employer, I think is incredibly important. We so often hear that employers, and I completely agree with this, employers are kind of uniquely in the broader healthcare landscape, that they are aligned, their purposes, their outcomes, intended are aligned with patients. They want to get high quality care at a reasonable cost. But it is just a little bit of a different way of thinking about entering the healthcare market. A few other things. One is, we've got employers who, particularly over the last 14 months, but even a number of years leading up to this moment, who have a number of what we call point solutions that they contract with. So, companies that are able to address, one particular condition, or one kind of, patient group. And oftentimes they're able to optimize the care for one, service or condition or patient group, and that's really wonderful. But we've heard, from employers that as they put in more, of these companies, as they contract with them, that by kind of slicing off one portion of your healthcare benefit, that for those people who are using it, you might create some, confusion or fragmentation in the care that they're getting, such that if you've got a strong strategy for connecting people to high quality primary care, but then you also have a program in place that's going to kind of slice off a chunk of that traditional primary care experience, that you might be sending mixed messages. And I think it's going to be really important for companies that are pitching to large employers these days to understand and be able to articulate how they can integrate either with other vendors in the market, with the healthcare delivery system, or how they're thinking about expanding the scope of services that they're able to provide in the first place, so that employers aren't going to have to contract with as many different companies and run the risk of creating a really fragmented and kind of confusing benefits ecosystem for their employees. And then I think finally, it's, you want to be able to articulate the outcomes that you're able to deliver on, speak to engagement rates. If, employers have, been frustrated in years past about putting in programs that sound really great, but then no one really signs up for them. And there's a lot of kind of teamwork between a vendor and an employer that needs to go in place to communicate and incentivize those types of programs to get people to use them. But, just be aware that that's something that you absolutely need to be able to speak to. And then, I think finally, you just want to make sure that, when you are approaching an employer, that it's often the case that they have solutions in place, or they've got vendors in place that are doing some of what a startup or an innovator company is doing. Whether that's going to be as good as what you're able to do is a different question. But some of the time, what you're competing against is not necessarily another new innovator in the market. It's the fact that some of the traditional partners that employers are pitching are doing something that you may already be doing, and so you're kind of competing against your competitors, but then also what's already in place. So you better be able to provide a service that's particularly differentiated and better than what's currently on the market, or you're going to have a hard time convincing people to go through a totally different process, create a new benefits kind of strategy or program for employees, and it can be challenging. That being said, it's an incredible market to work with. If you get traction in the employer market, it shows that what you're delivering on is valuable. Employers are well aligned with end users, and they can be really amazing partners to expand the scope of the work that you're doing. So I'm absolutely at the business group, and I've been here for several years because I love working with leaders from these companies, because they are really focused on getting better benefits and saving their employees money. So hopefully that's helpful.
You had so many great pieces of advice there. Something I want to tease out a bit is, are employers scrutinizing outcomes a little more just because there is so much saturation on the vendor side?
Absolutely. So I remember a particular conversation with a benefits leader at Fortune. Gosh, I don't know where they're on the Fortune 5. Probably Fortune 50 company, maybe higher than that. And she said that in the spring of 2020, they were able to put in new strategy, new plan design, and new vendor partnerships to respond to the pandemic in a matter of weeks, compared to what may have taken 12 to 18 months prior to the pandemic. So there was a huge, huge effort on the part of employers to respond to the pandemic. The fact that people were suddenly at home, or if they were workers who had to go into work, that there was a tremendous amount of stress and anxiety. Just a lot of things happening very quickly. And so you had vendors that were put in place. We saw their different estimates of, increases in digital health or virtual health visits, in the range of, thousands of percent increases in utilization of virtual health services. So, a lot of change very quickly. We also saw, payment modifications to kind of equalize virtual health payments to what employers had been paying for bricks and mortar visits. And again, I think that was probably appropriate for the that time when there was a lot of uncertainty, and we wanted to make sure that traditional healthcare partners weren't also going out of business, right? I mean, there was a whole system that needed to respond to both the impact of COVID and the kind of associated downstream issues that were going to be created by the fact that we were all at home and not seeing our friends and family and exercising as much and all that. So this is a long way of saying that there was a lot that changed very quickly, and now we see in 2021 employers really scrutinizing those new relationships that they put in place in 2020 to say, okay, what has worked, what hasn't worked so well. Now that we might be returning to some sense of normalcy, did something that we needed for a year or two, did it make sense to have it in place then and now move away from that strategy? So absolutely, your ability to articulate, outcomes, engagement rates is going to be really important. And I know it's sort of this chicken and egg situation for a lot of startup or emerging companies, where you go to a potential client and they say, okay, we want to see your outcomes, and you don't have that. You're looking kind of for that like first anchor client, or it's hard to kind of break in that way. And I think you have to look for the right partners, or find ways where you can show some success in the direct consumer market. We've got some companies that come from outside of the US and have experience working in government programs in other countries that have gotten some good traction with employers here. There are certainly different ways that you can kind of prove out, some of those, endpoints that you're able to achieve for your patients, your users.
Can I throw in a bonus question?
Sure.
Where do you think the future of employer health benefits is going?
I think it's hard to say, which is, I'm sure, a shocking shocking answer. This is a really helpful answer for the audience here. I think, if anything, the past year and a half has shown us that for an employer to be successful at its job of creating widgets or providing services or doing whatever it needs to do on its business side, it's got to have a healthy workforce that's able to do their job, whether that's at home or in the workplace. And the only way that an employer is going to consistently be able to do that is to use their considerable resources to engage with the healthcare system. And employers are going to do that in their own way. There's hundreds of companies that we work with, and they've all got their own boards and geographical footprints and businesses, and oftentimes we're asked to speak for the employer community overall, and it's really hard to do that because there's a lot of different perspectives. But I do think that if anything, the employer healthcare market, the case for employers being actively involved in the health and well-being of their employees has only increased. So take that with a massive grain of salt, but that's kind of my perspective on it.
Perfect. Well, Dylan, we're running out of time here. Is there anything else that you think would be important for our audience to know, just in terms of supporting employees' mental health and well-being through such challenging times?
Yeah, I think one thing that we haven't talked about specifically, but it's certainly related to just about everything we've been talking about, is just caregiver stress and the importance of just kind of influencing the culture at a company. I think as we think about those employers, members of ours who have been particularly successful in supporting their employees in the past year and a half, it's not just about putting in, a shiny new program or creating a new service line to provide, particular benefits for certain conditions. It really requires a culture that is supportive, that meets people where they are in the office. We see a big increase in the number of our employer members who are doing manager and peer trainings to be able to kind of talk confidently about struggles that people may be having related to mental health. And so I think that we can't lose sight of the fact that a lot of what employers do to support the mental health of their employees is just basic, what it's like to be in the workplace, how people interact with each other, how people are, supported in a way that encourages them to and allows them to be their best selves. So, understand that employers have a lot of different ways that they influence the health and well-being of their employees, and it's never been as challenging as it is right now. But again, I think the silver lining to all of this in the past year and a half is, that we are seeing into each other's, oftentimes into each other's homes, and the kind of structure of a number of the companies that we work with, and in general, has gotten very flat. My CEO and others at other much larger organizations are working from home, and you can see they're I've been working in my bedroom for the past year and a half until we moved to a bigger space. And I had a meeting earlier today where my kid ran in, and I think there's just kind of bits of humanity there that maybe we hadn't seen previously. So it gives me some some optimism for the future. And as an aging millennial with a couple of kids and a mortgage and a receding hairline, I am really heartened by the fact that people in their teens and their 20s are talking about mental health in a way that millennials like myself had started to do, and I just think there's a tremendous opportunity to really support each other going forward.
Yes, I have such high hopes for the future generations to continue to talk about mental health more openly, reduce stigma, but you've got really great points around an employer can have a number of different widgets and virtual health solutions, but if there isn't that culture of embracing employee wellness and mental well-being, then a lot of those can just sit and collect dust. So totally appreciate that, and appreciate your time and all of the incredible work that you do at Business Group on Health to support employers to navigate these challenging topics. Thank you so much for joining me, Dylan.